Hello, I'm a level 1 nursing student and was wondering if I could follow you today.
Sure, you're here for Marta Yarn?
Yep,
Alright. You want to know a little about
I
it?
do. I would like an SPAR report.
She's in room 529. She's 80 years old. She weighs 175 pounds. No allergies. She's a full code regular diet, up with a walker and standby assist. She was admitted from the physician's office, direct admit. She has a non-healing sacral ulcer. She's had for 3 months. The patient has been treated as an outpatient without success. She had debridement done to help, and she led to a decreased appetite. The last admit was 6 months ago. She does not smoke, no history of heart disease or chronic illness. She lives alone in a senior housing apartment. She complains of generalized weakness, denies numbness below the sacral area. She's slightly hard of hearing, limited visual activity, no complaints of headaches, change in vision, nasal problems, or a sore throat. She has had multiple admissions for ammonia in the last 6 months, and she has not required long-term oxygen therapy in the past. And chest expansion is symmetrical, clear in all fields, and she has diminished sounds in the bases of the lungs. She denies chest pain, palpitations, or shortness of breath. She had sinus rhythm with occasional premature beats. She complains of occasional stress incontinence with nocturia. She verbalizes a decreased appetite. Abdomen was soft, non-distended, with sounds present in all 4 quadrants, and the patient is also slightly obese. Urinary system was normal besides the occasional incontinence that she has. Last vital signs were she had a 99.1 temperature, heart rate was 88, O2 was at 92%, blood pressure was 144/90, and respiratory rate was 22. She has an IV in the right dorsal metacarpal with a 20 gauge needle or 20 gauge, and no red. It's not red or swollen. Last time it was checked. She gets a gentamicin IV piggyback that at 4 o'clock, which is 80 milligrams over 100 for 1 hour. She also has sodium chloride running with potassium chloride, 20 milliequivalents over 1,000 milliliters. Her wound came back positive for E. coli, so that's why she's getting the gentamicin, which is antibiotic. Labs with the gentamicin, it may increase BUN, which she does have a BUN increase of 22, normal's 10 to 20, and in this gravity is 1.01, which can also be increased, so you need to watch that, but that's normal right now. Phosphates 3, albumin's 3.2, and creatine's 1.1. Any questions?
Why specifically is this client receiving this medication, and what action does the medication have on the body?
So the patient came back, her wound came back with E. coli, so the medicine inhibits the protein synthesis of the bacteria, so it's gonna help get rid of that.
Okay, when should you question administering the medication? And does this medication have a therapeutic serum level?
You want to check if she has any allergies to the medication. If an abnormal dose is ordered, you want to call and check to make sure that's correct or what the correct dose is. You want to look at the labs, which we mentioned earlier, and any vital signs that relate to an increased infection or anything.
So, like, what vital signs must be monitored? Are there any specific ones?
If you mainly want to look at if the wound is getting redder or more pain or anything like that.
Okay.
You said therapeutic serum level?
Yeah.
That was 2 to 2.5 milligrams per kilogram.
And then which physiological parameters should be monitored when the medication is being administered?
So another thing with the vital signs, like you said earlier, you also want to assess for, like I said, an increased infection. So they have a fever, upper respiratory problems or diarrhea can indicate an increased infection.
Gotcha. What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting?
So you want to use the 5 R's, which is right dose, right route, right medication, right time, and right person.
And then what interventions must be taught for taking the medication safely at home?
So you want to make sure they know the side effects of the medication. You want to make sure they take the complete dose and don't stop early if they think that the infection's gone. And yeah, they occasionally they should have their blood checked to look at the labs.
Okay. What are the side effects and potential adverse reactions?
So vertigo, hypersensitivity, nephrotoxins, that's nephrotoxicity.
How will you know this medication is effective?
You want to reassess them later and make sure the infection is getting better.
Okie doke. That's all I need.
All right. You ready to give the medication?
I am.
All right.
Come in.
Hello, Mrs. Marta.
Mm-hmm.
Can you tell me your name and the year you were born?
Oh, it's Marta Yarn.
All right, good. And do you know what year you were born?
What was that, sweetie?
What year you were born?
I was born in 1930.
Perfect. Alright, so we're going to give you your gentamicin because of the bacteria you had in the wound,
Okay.
which is an antibiotic. Have you had the medication before?
No, I've never had this. I don't think I've had this medication before.
Do you know any allergies?
No, I don't have any allergies.
Alright, and you know you have the right to refuse the medication.
Oh, yes, I know that, dear.
Alright, I have some information for you here that you can read up on. Alright,
Thank you.
and I know you have a pressure ulcer on your sacral area. Is that giving you any pain?
No.
Alright. So let me scan your wristband.
Okay.
How was your lunch?
It was good.
Good food here?
Well, I have no teeth, so they mash it up for me, and I do my best.
Alright.
I think it was porridge. Why did you spill the medicine out?
I'm just priming the line here.
What does priming mean?
Getting the fluid through the line. Getting all the bubbles out here.
No, I don't want any bubbles in me.
Sure.
I'm sure.
Hook this up here. Let's see. You see your wristband? Let's see. The 20 milliquidants. That's 80 over 100. Alright, so now we're gonna run that piggyback here. Oh boy. Got some air in the line. See your wristband? Can you tell me your name and date of birth?
Marta Yarn, 1930.
Alright, and then we're gonna run the check ice in here. We're gonna hang this on here, so it needs to be running lower than antibiotic.
Oh, what's that?
So that we can, because you want the antibiotic to infuse in first, and then it's gonna be followed by this, so it needs to be hanging on a little lower. Okay, we're gonna
But if it needs to be hung lower, why are you making it lower like it is right now? Why are you holding it lower?
so I can back prime here.
Oh, like you did before with the other medication.
Yeah.
You're getting the bubbles out.
Now we're gonna hit C channel select, secondary, gentamicin once daily.
And also her immune levels are kind of low, which is 3.2. And with the patient, it's limited.
Alright, so you're gonna get
Also, these are the walker, so she will be an assistant to get up. Her skin is kind of frail, dry, and from that,
80,
doesn't
oops,
have any
100, and you
no
weigh
underlying or accounting bruising.
175 pounds in kilograms, that is
Demonstrating someone's in base. Patient has sinus rhythm and with occasional puncture.
79.5, so we go with 80.
Soft, not tender. State that she has decreased appetite. We'll want to keep her diet, or we'll teach her about her diet since her meat levels are pretty low.
Alright, so we got that running now.
She's a regular diet, but
How's that feeling?
Oh, it feels great.
Alright. Just charts and stuff here.
Medication contains location and stress symptoms without hypertonia. So other than that, there's no problems with her. So
Alright, do you have any questions about the medicine, or I gave you some information you can read up on different side effects and what the medication does.
Okay.
Alright.
Thank
Come
you.
back in and check in you in a little bit, alright?
All right.
and we'll also monitor her vital signs of blood work kind of high due to the infection that she has. So we'll monitor all these things.
So do you have any questions?
Were there any pertinent pieces of information you reviewed before administering the client the medication?
So you want to just make sure they don't have any allergies, check the 5 rights, tell them that they have the right to refuse, and you want to check vital signs to make sure the infection's not getting any worse.
Did this information affect your decision to administer the medication?
So if you notice that the infection was worsening, or there were any because of the vital signs, you would call the doctor and let them know and see if they want to change anything, make an adjustment.
Did this information affect how you administered the medication?
No, because everything checked out how it should have, and the infection is staying about the same, so we're just going to go with the dose that was ordered.
All right, that'll do it.